Welcome to your TT session on the cerebral circulation. So here we have a diagram which we'll start off by labelling. So firstly, there's two main blood vessels that you need to know about, which is the internal carotid artery and the vertebral artery. And there's two on both sides, so a right and a left internal carotid artery and a right and a left vertebral artery. The cerebral circulation is supplied by three arteries, the anterior cerebral artery, the middle cerebral artery, and the posterior cerebral artery. The middle cerebral artery is made as a continuation of the internal carotid artery, and it's the biggest artery out of all three of them. It's also where most commonly strokes occur. The two anterior cerebral arteries communicate with each other with the anterior communicating artery, which is situated here. There's also the posterior communicating artery, which you can see here. The ophthalmic artery is also a small branch of the internal carotid artery. The vessel just right under posterior cerebral artery, is the superior cerebellar artery. And these small branches that you can see are the pontine arteries. The next artery down is the anterior inferior cerebellar artery. The posterior inferior cerebral artery is this very small branch here. The two vertebral arteries join up together to form the anterior spinal artery. Now this supplies the anterior 2/3 of the spinal cord. The two vertebral arteries also join up together to form this very thick artery called the basilar artery. And there you go, here we have the circle of Willis. For further reading, have a look up on the signs and symptoms or the way a patient might present when occlusion or infarction occurs in areas supplied by mainly the three cerebral arteries.